This conference will now be recorded.
Good morning, all of you all. Can you hear me? Can you hear me? Anyone please answer? Yeah. So today, again, we are moving on with the applied exercises. I hope you all know that your exam date is tentative exam dates have come up for March. So you are almost in the home from past 8 or 9 months. Please read up the subject. Any doubts you can come and clarify with us before you start your the proper lectures. When you come here also, just go on with your practical classes which have been pending there, but still we are trying to cope up with the theoretical part so that when you come back we just show you the specimens how it looks, and so that we can move out, so it becomes an exercise or a revision part. So today we are going on with the applied exercises, Candida albicans, that is one of the fungal infections. Can anybody tell me why the fungal infections have gained importance in the present day life, which I have almost told in most of the classes? Can you anyone tell me why the fungal infections have gained importance in the present day life? Anyone? Anyone please open up. It's not just tough question, it's a simple one.
Common in immunocompromised patients.
Yes, common in immunocompromised, because immunocompromised patients have increased in the recent life. Fungal infections are also increased, so we are studying more of the fungal infections. Which type of immunocompromised patients? Can you give me examples? Can anyone give AIDS, HIV, where the CD4 cell count is less? It directly affects the cell-mediated immunity. Any other examples? Two more examples.
Cancer.
Pardon?
Cancer chemotherapy.
Cancer
Patients
patient.
undergoing cancer chemotherapy.
Cancer chemotherapy accepted because there is destruction of the cells, as a result of which immunocompromised state is there. One more important one.
Transplant patients.
Yes, good going. Transplantation, organ transplantation has increased in the recent years, which may be from eye to the any organ, liver, kidney, heart, also transplantation for all the transplant patients. To avoid rejection, suppressive therapy has been given for a longer time, and all these are some of the predisposing, even bone marrow transplantation, predisposing factors for the fungal infections. Normally, usually they are commensal organisms, but sometimes they can be more dangerous infections. In fact, treatment becomes very difficult. Now coming to the Candida albicans, is it always pathogenic? Is Candida always pathogenic? Anyone?
No.
No. Why? Is it present in our body? Is it present in our body? Yes, it's present as a normal commensal. Can anyone mention some sites where it is present? Can anyone? Pardon?
Oral cavity.
Oral cavity is one site where Candida is present. Another spot, another area, another area.
Skin.
Skin, no. Any other area? There is one chapter called normal commensal which has already been dealt to you also. I think, if I'm not wrong, Srinivas sir has dealt with that. It's in the end topics. Please read that topic. It's very important. Tomorrow when you go for the specializations like surgery or anything also, you need to know about that. So Candida one is not present, as Dept has already spoken about. It's in the oral cavity. Second one in the genital tract of the females, that is in the vagina. So you need to remember in these two sites, whenever you are giving whenever your report, gram strain report or any culture report is showing Candida, you need to differentiate whether it is pathogenic or non-pathogenic. So Candida is one of the common organism along with the Cryptococcus. In fact, cryptococcal infection, cryptococcal meningitis has been very common after the advent of HIV, but still Candida, there are two types, main divide Candida albicans and non-albicans species. In India, still Candida albicans species are very common, whereas in the foreign countries, non-Albicans species have also gained importance. So with this background, this is a practical class, not a theory one. I'll just move around. I'll just, you need to have one, record. Can anyone have your record in your hand? Anyone have your record? Please write down the questions in your records. This is the case history. I'll just give me a second. I'll just get the record. Ramya? ఒకసారి record. So you can see this is the questionnaire. You can clinical history. This is how the patient can present with the clinical history. Please keep your records updated. When you come here, we won't give you any time because we will have a very short time. We don't know when you will be coming, either in the end of the December or second week of December, or maybe in the January also. You have one of the third internal exam also, so you'll have a very short time. It's don't take my words lightly. Please start reading one point. When you have any doubt, please come and clarify with us. We are open to you because our contact time with you was very less because of the pandemic situation. Hardly you were with us for 4 months. These online classes, we never know how much you all understood. Whatever it is, we need to go up with the pandemic situation. So you have to please read down and keep your record also updated. Any doubts regarding the records also, you can give us a message so that we'll try to clarify your doubts. So your page number, there is no 191 in the record. Please see 191 is the same question. So this is the bottle-fed infant bought with the creamy patches on the tongue and buccal mucosa, scrapings from the lesions collected under sterile conditions and sent for culture. So fungal culture sensitivity is also there. There is no doubt, but it's done only in the few situations, not in our situations. You can see the pictures also. These are the lesions, okay, buccal mucosa and also in the tongue. You can see these lesions. These are white patches like lesions which are seen in the one. So first question will be, these are all your applied main exercises. Don't neglect it. It carries around 15 marks. Again, I'm repeating, 15 for gram, 15 for Zn staining, 15 for applied exercise, and 15 for stool examination. All the exercises you need to complete, and along with the 10 marks for your spotters. This is your practical examination schedule. Proper one. So you need to complete all the exercises. Don't neglect that. Hardly 10 or 11, 12 applied exercises we have spoken of. If you read these exercises, you can easily score regarding that. So, but your questionnaire will not be limited. Your questionnaire can go in detail about those topics. So, first one is mere examination. Observe the slide under microscope and give your findings. This is your question. The given smear is a gram stain smear showing violet colored oval budding yeast cells. So you have a proper budding yeast cells, or you always differentiate when you are speaking about gram staining about gram positive cocci and gram positive budding yeast cells. You can see in gram positive cocci, usually they are grape-like clusters. And the first point which you need to look after is here the buds. You can see these are oval buds. Along with the oval buds, the size you can see, the size of these buds are very larger when compared to the cocci. The cocci are very small in micrometers, whereas the buds are usually larger. So this clearly differentiates between gram positive cocci, that is a bacterial organism, and this is a fungal organism. So you can see this is a sputum spear. You can see here these are gram positive buds. Okay, along with gram positive buds, you have pseudo hyphae. You can also have a gram negative tinge. There is no wrong in that, so don't worry about that. But when you are speaking of, you please speak as gram positive buds. So you can see along with the gram positive buds, big cells with a central nuclei. These are all epithelial cells indicating this is a sputum sample. Of course, there are some gram-negative bacilli also. We don't care for that now. I just want to appreciate what is. These are long hyphal forms that are called as pseudohyphae. Why I am stressing on these pseudohyphae cells are usually commensal organisms do not contain the smear which contain commensal organisms do not contain the pseudohyphae. If pseudohyphae is there, that indicates it is 100% pathogenic. So when your sputum smear, I'm given as a gram stain smear containing gram-positive budding yeast cells. So no need to worry, that can be a commensal because apart from the sputum, your saliva would also, patient saliva would also come. So that might be a differential diagnosis. But if I mention as a microbiologist, if I mention along with pseudohyphae, then the clinician should become alert and he should think that he need to treat that patient even for the fungal along with the bacterial organism. So that one point you need to keep in mind. So this is how gram staining. So at this point of time, an examiner, if you are sharp enough, you are answering all the questions. He might ask about pseudohyphae. He may ask how you differentiate gram-positive budding yeast cells from gram-positive cocci. What are the differences there? So as you move on, describe the colony characters on the slide. So you have one media which we use for the fungal common media. Of course, there are other fungal media also. But at this point of time, at your UG level, Saprots, dextrose, agar or SDA media is the one media most commonly used, which shows creamy white smooth colonies with yeasty odor. You can see creamy white colonies, yeasty odor is there. But this creamy white appearance is also seen in case of Cryptococcus also. In Cryptococcus also we see this. Again, one more difference in gram staining between Cryptococcus and Candida is Cryptococcus you have ovals, you don't have oval cells, you have spherical cells, larger spherical cells, whereas for Candida it is oval cells. Both are gram positive only, both are fungal organisms only. On SDA also, this is somewhat yellow tinge media where you get white colored colonies in both, whereas dry colonies, dry smooth colonies are the characteristic feature of Candida, whereas mucoid colonies are a characteristic feature of the Cryptococcus. That mucoid appearance is due to the presence of capsule, which is characteristic feature of Cryptococcus. So for the usually confirmation of the Cryptococcus organism by identification of the capsule by India in preparation, where you can see the halos under the microscope. So third question, what is the test done for the identification of this organism? And write down your observation under the microscope. So whenever you speak about the Candida, you need to differentiate between Candida albicans and non-albicans species. Albicans species, you can see germ tube test. Please read this part. Germ tube test and chlamydospore. Next slide which I am show. Both are important. Most of the time these are stock questions and we expect you to answer this, but frankly, most of the time you don't answer. Again, I'm repeating. So germ tube test. This germ tube test is done for the Candida species. We're showing elongated yeast cells with pseudohyphae, where in a small test tube we take a small amount of plasma. With that, you add small amount of the Candida or suspected Candidal organism. After 3 to 4 hours, you put a drop of that broth onto a slide, put a cover slip and see under the microscope. When you see under the microscope, you can see this is the mother cell. You can see my cursor. This is the mother cell. From the mother cell, a large tube has come out and that tube is called as germ tube. So this is the mother cell and the tube that has come out is called as germ tube. You can see the upper part also. This is the germ tube test. So these are called as germ tube test. That is cells with pseudohyphae. Here also you can see. So this indicates confirmation of the Candida albicans species. One more test which most commonly is called as for the identification of chlamydospores, and these chlamydospores, this technique is called as Dalmo technique. I repeat, this technique is called as Dalmo technique. Dalmo technique for the identification of the chlamydospores. So chlamydospores are produced only in the nutritionally deficient media. Nutritionally deficient media, because these are spores. You know about the spores. The spores are produced only in nutritional deficient media. So for Candida, we try to create a nutritionally deficient media by using cornmeal agar. So on the cornmeal agar at 28 degrees, you try to streak the suspected Candida colonies, and at the end of the streak line, you just put a cover slip. You can see here, this is the picture. This is the cornmeal agar. On the cornmeal agar, your suspected candidal growth you streak. At the end, you keep a small cover slip. After 2 to 3 days, usually after 48 hours, that is 2 days, when you see under the microscope, you can see this chlamydospores. So these are hyphal forms. At the end of the hyphal forms, you can see these chlamydospores, which are characteristic features of the Candida albicans. So this test is another test which helps in the identification. When you come here, we'll try to show you this. But till then, keep your record updated and also try to read these points so that when you come here, it's just a revision class, because we don't have much time to deal with, because shortly you'll be having your internal exams followed by your practical final exams. So things will go on very fast when you reach the college, because we have lost almost 8 or 9 months. If you need to, if you shouldn't lose your academic year, universities have decided they need to complete the examination on time. So please keep your self updated. Please read. Don't think because of the pandemic situation you will be given easy marks and you will be given easy paper or you will be passed easily. No. Things have gone, all the chapters have been completed, everything has been completed, so there won't be any difference within previous examination. And please read again. I'm telling you, your next batch has a completely changed syllabus and curriculum. You can't compete with them. That things are completely different. Their examination pattern is different and their examination questions also is different, because that's completely clinically oriented. So please complete on the first attempt. It's my request. I don't know whether you have read till so many days or not, but still now you have time. Please start reading. Go on with the subject. If you find something difficult, no need to worry. We are always open to you. You can come and contact us at any time. What are the common species infecting the human beings? So Candida albicans, as already told, you can see various diseases caused by Candida. It can cause a number of diseases. A few examples I've mentioned in the last part. What are the other manifestations of the Candidal infection? So cutaneous manifestation, you can see paranoia and onychia. So paranoia, you can see this is all whitish powderish form which is looking or fungal infection. So it is the paranoia is infection of the soft tissues surrounding the nail. You can see here, this is the soft tissues or subcutaneous tissue. This is all fungal infection. Whereas proper nail infection is called as onychia, that is on your right side. So this is called as onychia, where you can have the nail infection. Nail infection is onychia, whereas paranoia is the infection surrounding the nail, that is soft tissues, that are subcutaneous tissues around the nail. Mucosal is oral thrush. Mucosal, you can see oral thrush. This is the oral thrush. Vaginitis also, you can see infection of the vagina. Chronic mucocutaneous candidiasis. These are just few examples, but Candida causes wide range of diseases. Candida is not only an applied exercise, it can also come as a short notes, that is 4 marks or 5 marks question. Of course, till now it has not appeared as a long question. Appeared as a long question is, there is one long question which is related to Candida. How is it related is, what are the opportunistic infections? List out the opportunistic infection, opportunistic fungal infection, and describe one opportunistic fungal infection in detail. In such cases, you need to list out all the opportunistic fungal infections. Along with that, you can write Candida or Cryptococcus in detail, or any other organisms which you feel comfortable. So last part is systemic infections. You can see esophageal candidiasis, intestinal candidiasis, bronchopulmonary candidiasis. All these have become common because of the decreased immunity due to various reasons which are common in the recent years. Of course, we need to identify the fungal infections because we have a good treatment for that. We have antifungal drugs which would have already learned in case of your pharmacology, that is amphotericin, blue cytosine and all. But fungal treatment is not that easy when compared to the bacterial treatment. One is it requires long-term treatment. For example, if you take about your nail infections, sometimes it may require up to 6 months to 1 year treatment also. In between, if you stop the treatment, the fungus may regrow after 1 or 2 months. Initially, you may feel that control is good, why this long treatment is required. But if you stop, again, it may rebound. So we need to be careful about this. Second, the drugs which we use, amphotericin B, blue cytosine, whatever it is, grisophulvin, okay, all these drugs have their own toxic effects. So it's up to the doctor to decide whether these drugs are suitable for his patients or not. And we need to monitor the other conditions also of the patient before starting this treatment. But we need to complete this treatment. Of course, HIV patients also most of the time may land up with this candidal infection, especially oral thrush and esophageal candidiasis. We need to treat them. So, and you have IV drugs also and also oral tablets, both can be used. So you have, please write down all this. If you want, I'll just go back to the slides for a minute or two so that you complete same questions, same you write down. Picture, initially gram stain picture is that you can draw. If you feel the picture is tougher, anyhow when you come back, we'll show you the media and gram stain microscopic features under the microscope, then you can cope up with it. But please don't neglect, again I'm repeating, please complete your records, please keep yourself updated. Okay, so this is the one. I'll just give 5 minutes. I'll just go back to the slides. Do you require the slides again? Do you want to project the slides again, or is it okay for you? Anyone? If you want, I'll just project it for 2 minutes for each slide. If not required, then I'll just close up the session. Anyone? You can put up in your chat box. Okay, I'll just go on. This is the first slide, case history. Same thing you need to write down. I just told you the page number also, 191. Keep your records updated. 191 page number. Next, second smear, the right one. You can draw this diagram. Only one diagram. Please mute yourself. One sheet, please mute yourself. All of you mute yourself. Same thing, question 1. This is the second question. Describe the following characteristics on the slide. Describe the colony characters on the slide. You need to draw this diagram. See my cursor on the left side, slant with white patches. Please use proper color pencils. You need to use proper color pencils. Please make it a habit to use proper color pencils even in your examinations. That will fetch you good marks. Third question. What is the test done for the identification of the organism, and write down your observation under microscope? Germ tube test. Please draw this diagram. Left side diagram, please draw it. Moving on. Fourth one, what are chlamydospores? You can see this, what are chlamydospores? Left side diagram you need to draw. And speaking about the diagram also, these are all line diagrams, so no need to worry, you can easily draw. Okay. What are the common species of Candida albicans? No diagram at this point of time. Last one, manifestations of Candida. This also no diagram is required. So this is the mucosal lesions. Okay, this is the final slide. Okay, 108, Srila has asked one question. Is it okay if we draw all the diagrams at the end of your the questions? Okay, it's fine, but use proper color pencils. There's no issue. You can draw at any time. One more, you're supposed to draw the diagrams only in the corresponding questions. No problem. You can draw at any point of time. But see that you complete the one. Okay, any other questions? Anyone have any doubt? Anyone have any doubt? Okay, then I'll move on. So this has completed. Please complete your one. Next classes also you'll be speaking about spotters and all. You just write down the theory part and also the diagram. When you come here, we'll just show you the microscopic pictures. Okay, read it properly, because in spotters also, if you want to gain your complete 1 mark, you need to write 2 identification points. Then only you get the full marks. You need, spotters are very easy. Please have your score at your, it's in your hand. 10 marks you can easily gain that. So next week you will be studying about the parasitology spotters, mycology spotters, and also general spotters. Now as we go on, we will start with these spotters. So have that also you have place in your record. Keep your in that record only write the matter on one side, diagram on the other side. Keep your diagrams, draw your diagrams well using pencil, scale, neatly. Don't draw rough diagrams only with the hand. Use proper color pencils. Don't make us to repeat, write your record repeatedly. At test stretch, we should correct your paper record. And please label it. Labeling the diagram is very, very important. Label it. Any doubt, you can contact us. Okay, thank you.